Hey guys, I've got a special treat for you today. It's going to be about deep learning in CT. Normally, the material here is for radiologic technologists. This was a talk that was given at the American Association of Physicists in Medicine, so it's a little bit more technical than some of the material here on the channel, but I think you're really going to get good benefit out of it. If you stick along to the end, you're going to really see how deep learning is really helping CT, especially to be able to reduce the noise in our CT images while still maintaining the same texture that we've been familiar with for a long time within our CT images. Coming up now. We're going to first go through the motivation, kind of the history within CT of going from filtered backprojection to iterative reconstruction to deep learning. We'll then talk a little bit about the methodology that we use at GE for our training of our neural networks for deep learning image reconstruction. And then also we'll talk about the evaluation and how we're demonstrating the improvements in the image quality for deep learning. And the outline here again is filtered backprojection and iterative reconstruction coming up first. Again, this is GE-centric slides, but the idea kind of is the same throughout the industry. That in the early days of CT, so the early 1970s with commercial products of CT, these were filtered backprojection based. Filtered backprojection is fast, it's reliable, and if the data is relatively well conditioned, namely if there's relatively low noise in the data, it's going to perform very well. In order to get that relatively low noise in the data, we do need relatively higher imaging doses. So these are characteristics of filtered backprojection, wherein we would call it excellent image quality if you have the relatively higher imaging dose. And then in the era of 2008 to what we're calling 2018, there was more significant improvement and the significant desire to have reduced radiation dose. So in order to have that reduced radiation dose, if we'd like to have a similar level of noise in our images, we need another technology. So iterative reconstruction came along, and iterative reconstruction was used first. What we call ACER was the one that G introduced at that time, and all of the other vendors in CT shortly thereafter came out with a solution in that space. G also introduced the first what we call model-based iterative reconstruction, which is a full geometric model for the forward projection. And each of these algorithms as well has some denoising built in, and that allows us to start with a little bit lower dose exam. And from that lower dose exam, we can reduce some of the noise in an adaptive manner such that we could have what we would call a good image quality. And we sat down then together. So in that era wherein we had just released the model-based iterative reconstruction, we sat down in Niskayuna at our GE Global Research, and we said, what could we come up with that would meet these characteristics? And we have these two plots, and this is the first plot where we're looking at recon speed on this axis and then contrast to noise on this axis. So obviously we want to improve the contrast to noise, and we want to do it relatively quickly. So model-based iterative reconstruction was very computationally intensive, and it would take significantly longer than the time that it took to image the patients, such that there could become backups in terms of the ability to keep up with the imaging. So we'd like to come up with something that we said at that time, we'd like to come up with something that would be up in here, where it would be running on the same order of time as the iterative reconstruction, but it would have those contrast noise improvements as well that we came to used to from the iterative reconstruction. At the same time, we were hearing from clinicians that the noise texture in the images was a little bit concerning. The more plastic appearance of some of these iterative reconstructions was concerning. So there was a desire to have a method that, while going fast in terms of the reconstruction time, also we wanted to have it have a contrast to noise improvement like we talked about at the same image texture roughly as filtered backprojection. Filtered backprojection, again, being basically the standard that everyone in the industry has been used to. So these were the two desires that we had at that time. And then several years later, we'll talk about the solution that we've come to. So the deep learning image reconstruction, obviously you knew the topic of this coming in, so it's those question marks, you're not going to be surprised when I tell you that deep learning was the answer to this problem. But where does deep learning sit in this whole soup of AI? So you have artificial intelligence, is the broader category. Within that, machine learning, then within that, deep learning. And the real advantage of the deep learning is that we don't have to train specific and identify specific filters to perform tasks, such as in machine learning. The deep learning network can actually train it itself, and it kind of is self-sufficient in that sense, as long as you're supervising it properly. And the deep learning has the advantage that we can incorporate many more parameters into our framework. So the model-based iterative reconstruction, we would have tens of parameters, less than 100 parameters. Beyond that, a scientist or engineer, you just can't process it, right? You can't think about that many parameters, such as the millions of parameters that can be involved in these deep learning neural networks. So, like I said, you're not going to be surprised. I filled in the question marks on that last slide with the deep learning image reconstruction, giving us significant improvement in image texture and the same or better improvement in the contrast to noise. Then what we're looking at here is just where does that fit in, again, on our timeline. So from the early 70s, filtered backprojection, and then the aughts to the teens, we're talking about iterative reconstruction. And from 2018 onward, we believe this is the era of deep learning for image reconstruction, and we're going to be seeing more and more of that going forward until the next technology is invented. So for the deep learning frameworks, again, you need to identify an architecture, you need to do the training, and you need to verify that you've trained the algorithm well. So the training is what we're going to focus on here. And again, this is one area where, as a vendor, you have a choice in as far as how you want to do the training. And so GE, while using data, clinical data that was acquired within standard of care imaging doses, we took data more from the top of that standard of care imaging doses. No one was given any additional radiation dose as part of gathering this training data. We took data more from the top of that end, so relatively higher dose data, relatively lower noise data. We performed essentially, you can think of as a noise insertion into the data, and then we had an output image coming here through our network, wherein we'd compare that output image to the ground truth image, and the goal would be to teach the network in order to achieve a lower noise image matching the filtered backprojection ground truth. The desire, again, to have a network which has noise difference images that don't contain a lot of structure, but more noise content. Then we can also do this on spectral imaging. This was, again, released as a product for gemstone spectral imaging for GE. And like we've talked about before, we believe for spectral imaging, it's very important to do that decomposition in the projection space. It's going to be the highest quantitative accuracy for your imaging, and it's also going to lead to the best beam hardening reduction. So for those two reasons, we're going to be using the water and iodine basis. So again, this requires a retraining of the networks, and we also want the networks to talk to one another and have basically processing such that water and iodine, the fact that there's correlation between those data, we want that to be known by the network so that the noise correlation can be accounted for when we're doing our denoising. And the output of the networks will be water and iodine images, and those water and iodine images then kind of seamlessly will go through the rest of our chain in order to generate monochromatic images, in order to generate additional material images. Those are also used for our virtual and enhanced images, and we also support metal artifact reduction, for instance. So all of that full imaging chain can work along with this TrueFidelity for the reduction of noise in the images. So Again, we had to do additional retraining, so these were separate releases for the commercial products, but the idea of applying these networks is the same, and in both cases, we do the training. We do it with scientists, engineers, application specialists, radiologists, cardiologists, and it's all done in-house. Once those networks are finalized, they are locked, and we put the networks, lock them in the lockbox on the individual computers, and either whether it's running on the cloud at your site or whether it's running on the console directly, the idea is that the networks are not learning on the fly while you're doing your imaging at your institution. Then we're going to talk about the evaluation. The evaluation obviously is important, and the entry ticket here that we talked about for any of these algorithms is to have a reduction in the noise, so namely an improvement in the contrast to noise. So that's been demonstrated in multiple cases, including in the liver and the pancreas. I'm showing you here in the brain, because again, we talk about this being a very challenging scenario. We're looking at soft tissue structures. They're just several Hounsfield units different. And if you look at the standard of care iterative reconstruction, you're looking at contrast to noise here that's around 2. That's increased to close to 4 in the case of our higher level strength of the deep learning reconstruction. So we've achieved, our entry ticket of improving the contrast to noise. Then we talked about as well, we want to make sure the spatial resolution is preserved. Again, the spatial resolution we're going to measure with the modulation transfer function. Obviously, this is standard in the industry. And the modulation transfer function, you're typically looking at how do the different spatial frequencies propagate through your system, namely a signal with an amplitude and frequency of a given amount. How are the different frequencies going to be attenuated as they pass through your imaging system, wherein that imaging system includes the deep learning. And one thing that's important to consider for these algorithms is to look at different object types. So namely, we're going to be looking at different contrasts. In this scenario, this is done by Stikotovich et al. And the idea is that using a standard ACR phantom, we can look at poly, air, acrylic, bone, use that, those inserts in order to take the edge profiles from which we can get the modulation transfer function. In previous iterative reconstructions, it was shown that there was significant deviation between the different material types as far as what was called the task-dependent contrast noise ratio. But in this case, the deep learning is shown to have similar characteristics with filtered backprojection and similar characteristics amongst the different material types. Then want to look at just the image texture. So first, just visually looking at it. So what we did here is I just went to the store and I got a pig liver from the grocery store, and then I got some pig ribs. And the idea here is that you can even see as some of it is frozen on the inside and some of it's thawing on the outside. The CT number is slightly different here. But if you look within the center here region, you can see the idea is that the noise in our high strength iterative reconstruction is significantly more correlated than the noise in our higher strength deep learning image reconstruction. So the texture, just by visually looking at it, we can see the texture has a more natural appearance, and we want to quantify that then. In the same way that we quantify the modulation transfer, we quantify the noise power spectra. And rather than talking about the signal amplitude, we're talking now about the noise amplitude. And we're looking at, noise variations and how those will pass through our system. And the idea is that we can take those noise power spectra. If we normalize those noise power spectra to the area under the curve, it lets us see the shape of those noise power best and to do the comparison. So we've done that. Again, this was also published in that Stikotovich paper, and you can see that the filtered backprojection and the DLIR, the red and the blue curves here, are relatively close to one another, and the iterative reconstruction ends up pushing some of the noise power back, to the left, so more correlated noise in the images. That's demonstrated here in a more quantitative manner. We also wanted to note that early on, and then again recently, we've looked at the ability with our collaborators at Notre Dame and Purdue, we've looked at the ability to just reproduce model-based iterative reconstruction, but to do it quickly. And again, at a high level takeaway, it's possible to reproduce model-based image reconstruction. So deep learning model-based iterative reconstruction can be performed, and the qualities about the image can be kept similar. So if you train a network using model-based iterative reconstruction, it's possible to have essentially the same texture of your model-based iterative reconstruction preserved in your imaging. So that's one option when you're training your networks. We chose not to use that option. So again, DLIR, we wanted to have it be more similar to the filtered backprojection, but one option is to use model-based iterative reconstruction, wherein it is possible to have a texture more similar to what you're used to in your model-based iterative reconstruction. Again, now we're going to point out some areas wherein we believe that we're going to have significant benefits here. Again, the areas of challenge is where the noise is going to go up in the images. So one area where the noise is inherently going to go up in your images is with thinner slice imaging. With thinner slice imaging, you can see that this is our 5mm reconstruction with the same data, 1.25mm reconstruction with the standard of care iterative reconstruction, and then with the higher dose, with the same dose, but with the higher reconstruction strength on the deep learning image reconstruction, you can see a significant reduction in the noise. And this is seen clinically as well. Again, this is also from the Stikotovich paper. You can see clinically for the brain, you can see some areas, like if you look, for instance, at the calcifications, you can see some difference in the calcifications from the 5mm to the 1.25. But when going from the 5mm to 1.25, if you stop in the middle at that iterative reconstruction, you can see the noise is significantly impeding your ability to visualize the soft tissue. But with the deep learning, again, our noise texture now for those thinner slices is more similar to that of the thick slice filtered backprojection. This was also shown by the group in MTech with the abdomen case. Again, the idea being that they were starting with this scenario, 2.5mm iterative reconstruction being the standard of care at the time, and then looking at thinner slice imaging with the deep learning. So if you look at 0.625mm thickness with the high strength of the deep learning, this was actually preferred from the quantitative and qualitative evaluations. And because there is less partial volume averaging, right? You're not averaging in the Z direction as much. You're going to have actually more crisp boundaries in between those organs and vessels. So with the modern PACS, with the power scroll, there's not as much downside of having those additional images. And there's a lot of scenarios where thin slice imaging really makes more sense with these technologies. An additional side benefit we want to talk about is, for instance, on the Revolution and Apex platforms, you can cover the head in either 1 or 2 axial rotations. This is really nice to get the head covered quickly. There is still the possibility of a jerky motion during an acquisition. Typically, within an acquisition, if there is that kind of jerky motion, you're going to have streaking artifacts. So this kind of streaking artifact you can see right here. With the ability to know that we have noise reduction in the imaging from the deep learning, we can compensate for those motion artifacts by modifying our view weighting such that we can have, again now, an improvement in the motion artifacts at the same time as we have the noise reduction. So that's a side benefit on some of the scan modes within this technology. We also want to point out that for GSI, or rather for our spectral imaging, we talked about we're applying it on the water and iodine bases, again, are used to generate the monochromatic images such as the 40 and the 70. KEV images. So if we look at the noise, you can see for all those image types, we're going to have a reduction in the noise in comparison with our iterative reconstruction. Also, we want to do just some basic sanity tests. Sometimes when we're comparing our images, just stick a phantom in, standard phantom, look at your regular single energy protocol, look at your spectral protocol, and just make sure that you can pass those basic sanity tests. Some things that, we've done tests on internally or we've seen externally. Sometimes if you're trying to, essentially make up some of the decomposition data, it's difficult even just to pass some basic sanity tests. So this is part of, just our basic testing, that we're seeing similar levels of characteristics in just basic sanity tests. And we also talked about the thin slice imaging and single energy. Another scenario from the physics standpoint, that in addition to thinner slices, lower KEV imaging also leads to noisier images in general, right? So because you're going to have the noisier imaging in general, that's another area where it is very advantageous to look at using the deep learning. And this scenario that I'm showing here is relatively thin slice images, so 1.25 thickness, and then also reconstructed with 40 KeV, so at the low end of that energy spectra. And you can see that for the contrast, right, iodine contrast, you're going to have improvement in the contrast such that you can see here the borders of the contrast are well differentiated after the denoising using these neural networks. We also want to point out, we're not claiming a network to rule all networks, that we're not claiming that we've generated a neural network that's going to do everything. So the metal artifact correction right now, we're using the standard metal artifact correction on the system, but we're just demonstrating that it works well in coordination with the denoising. So you can see here, if you don't do any metal artifact correction, it's very difficult to visualize the soft tissue here. You do metal artifact correction along with the TrueFidelity imaging, you can now well visualize the soft tissue adjacent to the metal. We also have the properties like we talked about. Quantitative accuracy for our spectral imaging is very important. And as we discussed, we're using water and iodine basis images, and those images, again, have preserved quantitative accuracy coming out of the TrueFidelity imaging. You can see that for water and iodine basis images here. Like we talked about, if we have good accuracy there, it's going to correlate to good accuracy for the other materials and for the KEV imaging. We also demonstrated, previously on the single energy imaging, the noise texture benefits. We have those similar noise texture benefits in spectral imaging as well. You can see these are the noise power for the different water, iodine, and then some different example KEVs. Again, you'll note that the iterative reconstruction ends up with the most shift in the noise power, and that the deep learning is more similar to the filtered backprojection for each of these material types. So in summary, we just want to point out first, again, we're not saying that we have a network that's doing everything. And one thing we're pointing out here the network is not trying to do is not trying to change the image contrast. We do have some features wherein there is the option as a user to do some small modification of the image contrast. For instance, in the case of neuroimaging, for improvement in the gray-white matter boundary differentiation and the CT number itself between the gray and the white matter, there are small changes that are possible within our enhanced boundary feature. And those small changes within the CT number in the image actually can lead to significant improvement in the conspicuity of the gray and the white matter in your imaging. This is just one example that we're showing here. But the takeaway today, again, we want to make is we have the ability to use our TrueFidelity imaging, again, using deep learning image reconstruction, that allows for the significant improvement in the contrast to noise ratio without sacrificing the noise texture. And we can apply that both to single energy imaging as well as spectral imaging. And so going forward, we really see The era of deep learning for image reconstruction has started in 2018, and we're looking forward to doing further developments along this pathway, and we really appreciate your time. Again, I've been Brian Nett at GE Healthcare. Thank you. Well, that's very impressive. You stuck around to the end of this 24-minute video, so you know that you got something valuable out of it. So please give me a like below so that you can help push this on to other people in the industry and other radiologic technologists. If you haven't been familiar with our channel, check out one of our other videos, such as this one coming up about photoelectric and Compton interactions, which are the basis of all of our X-ray and CT imaging.